invitar al equipo de FIEL-NC, Gaby, Plasencia, Paulina, para lo que queríamos que era lo más importante en el día de hoy. La conversación más importante que queremos tener. Una sesión de escucha acerca de empoderar a la comunidad en el acceso a seguros en tiempos de cambio de políticas públicas. Estamos muy preocupados y queremos poder trabajar entre todos esta cuestión. Estamos, con nosotros estamos trabajando con este grupo que se llama Fostering Insurance Enrollment Among Latinos in Carolina del Norte, el llevar, aumentar la cantidad de personas latinas que tienen seguro de salud, un grupo desde el Departamento de Medicina de Familia y Comunidad, junto con Margolis y Duke University School of Nursing, gracias a funding de la KB Reynolds Charitable Trust. Hemos estado trabajando en esto. Paulina, el próximo. El Project FIEL-NC ofrece talleres gratuitos. Hemos estado ofreciendo gratuitos talleres de seguro de salud en español para ayudar a que nuestra comunidad comprenda sus opciones y que se conecten con los recursos. Cómo hacer para tener seguro de salud, ya sea por Medicaid, por el ACA, o qué hacer si uno no tiene seguro de salud y cómo informarnos mejor. Lo que vemos, sí, la próxima, Paulina, lo que hemos visto es mucha duda, mucha preocupación acerca de qué es lo que viene, ¿verdad? Y cómo lograr empoderar a nuestra población en este momento de tantas políticas, de tantos cambios en políticas públicas. Adelante con la próxima, y ahí presento a Gaby Plasencia.
Hi, everyone. I'm Gabby Plasencia. I'm a family medicine physician and associate physician researcher at Rand Corporation, a nonprofit research corporation. I'm also a physician at El Futuro, which a lot of you might be familiar with. And so, given my role in health policy research, I wanted to introduce some of the recent changes and introduce.
You have an echo, Gaby. It's hard to hear you.
Can you hear me a little better now?
Yes.
And introduce the topic that we want to talk about today. So next slide, please. Our research with FIEL-NC has focused on helping people get insured and understand enrollment and eligibility for Medicaid specifically. And so we know that a lot of these bills that have recently been passed or discussed might affect how people feel about getting enrolled in certain services. And so some of these changes include, number one, the one that was passed just recently in the Senate last night, or the night before, sorry, which includes things like cuts to Medicaid, a work requirement for Medicaid, and more frequent redeterminations. Next slide, please. There's been cuts to funding for services that have helped people get enrolled in insurance. For example, the NC Navigator Consortium lost 90% of their funding nationwide, not just in North Carolina. And that's been a major resource for people to help get enrolled in Medicaid when they've had trouble figuring out how to navigate the application process or find out if they're eligible. Next slide. And there's increased fear about whether or not to apply for public benefits, interact with government agencies, or even just be outside of your home, outside of work, outside of your normal places, unless absolutely necessary, because of the increased deportations or media coverage of deportations, and it heightened narrative around profiling and other fears. And all of this leads to more mistrust of government agencies. And we also have heard in the news that government agencies are also making deals potentially to release personal information. As you can see here, IRS had a deal to share tax information with immigration authorities, and immigration authorities have been seeking access to Medicare data in other states. Has not happened in North Carolina, to our knowledge. So, for this reason, we wanted to have a community listening session with community based organizations, with community health workers, with community members directly to hear about how you feel these policy changes and the political discourse right now might impact the use of or enrollment in services like Medicaid and others. And now with that, I'll transition to Paulina.
So we're going to be using Menti for the first portion of our listening session. I'll be putting the links in the chat as well. You can either use the direct link or you can go to menti.com and then enter the code on the screen. I'll give everyone a couple of minutes while I also put it in the chat. 1 second. Okay, I just put it in the chat as well to either scan the QR code, use the menti.com and the code, or the direct link, and then I'll share screen and move over to our Menti. Okay, so I see a couple of folks have already gotten the chance to put in some words: exhausted, desanimada, discouraged, triste. And so the first question here, en una sola palabra, ¿cómo describiría lo que estos cambios le hacen sentir? In one word, how would you describe your feelings about these changes? Worried, frustrated, afraid, nerviosa, helpless, enojada. Just give a couple more seconds, because I know folks are probably still trying to join the Menti. Tired, miedo. Okay, thank you for your participation. We'll move over to the next question now. ¿Qué preocupaciones tiene sobre estos cambios recientes y cómo podrían afectar a usted, su familia o su comunidad? What concerns do you have about these recent changes and how might they affect you, your family, or your community? And this one is a short answer, so you can put in more than one word. La inclusión, menos acceso a cuidado médico y otras necesidades. Personas van a morir a causa de eso. If you're having issues joining the Menti, you can also put any comments in the chat, and then Viviana, if you want to read any that come through in the chat out loud. Empeoramiento de la salud local y nacional, lack of access to services, poor health outcomes, layoffs and closures within the healthcare system, aumento de estrés. Just give 30 more seconds and then we can move on to the next one. Mucha preocupación sobre la falta de acceso y miedo de cómo las cosas van progresando y el impacto en nuestro día a día. Más propensos a hospitalizaciones sin necesidad cuando ya teníamos ayudas establecidas. Menos recursos aún. Que va a ser más costoso cualquier proceso. Falta de atención médica y prevención de enfermedades a los que más lo necesitan. Okay. I think we can move on to the next one. Now we have a couple of short multiple choice questions. Dado estos cambios, ¿cree que usted que la comunidad latina estaría más, menos o igual de dispuesto a inscribirse en el Affordable Care Act o Obamacare? Given these changes, do you think la comunidad latina would be more, less, or equally willing to enroll in the Affordable Care Act, also known as Obamacare? And we'll give some time for folks to enter their response. I think we have a clear leader here so far. I see we have 17 people on the Menti, so I'll just give some more time for those that haven't gotten a chance to enter their response.
Y si la quieren decir en voz alta, nosotros podemos capturarla también si no están pudiendo entrar al Menti. If you're not able to enter into the Menti, veo ahí en el chat, menos dispuestos por temor.
Okay, we'll move to the next one. Similarly, dado estos cambios, ¿cree usted que la comunidad latina estaría más, menos o igual de dispuesto a inscribirse en Medicaid? Given these changes, do you think la comunidad latina would be more, less, or equally willing to enroll in Medicaid?
¿Ella estaba queriendo decir algo?
Okay, so it looks like we have another clear winning answer here. Go to the next one, just have two more. Dado estos cambios, ¿cree usted que la comunidad latina estaría más, menos o igual de dispuesto a inscribir a sus hijos en Medicaid? Given these changes, do you think la comunidad latina would be more, less, or equally willing to enroll their children in Medicaid? And again, you can also put your response in the chat if you're not able to join the Menti. Okay. Looks like there's some movement in the chat.
3 people added menos or no.
Okay.
4 people.
Okay, sounds good. And then we'll move to the last question here. Dado estos cambios, ¿cree usted que la comunidad latina estaría más, menos o igual de dispuesto a acceder a otros beneficios públicos, por ejemplo, SNAP y WIC? Given these changes, do you think la comunidad latina would be more, less, or equally willing to access other public benefits such as SNAP or WIC? Luis also put a comment in the chat, less willing to send children to schools as well. Okay, well, thank you for your participation on the Menti here in the chat. I'm going to stop sharing screen and move back to our PowerPoint, and then Viviana is going to facilitate the next portion of our listening session. 1 second.
Entonces ahora nos gustaría hablar con todos, ¿verdad?